So on this video, we're talking about professionalism. And yes, I don't have a suit on, I don't have a tie, because we're going to talk about professionalism does not have to mean a suit and a tie, a blouse, a necklace, all that stuff. Let's get right into it. Yeah, it's one shot, now the future is yours. Turning dreams into reality. What's going on, guys? My name is Coleman. I'm a physical therapist and the co-founder of PT Grind. And on this video, we're basically talking about one of the biggest pet peeves that schools have told us about. It's really this thing called professionalism. And now, like I said before, it doesn't have to be a suit and a tie. It doesn't have to be, you in this sturdy posture and like, hi, Mr. and Mrs. So-and-so. Like, no. That is not what they're talking about. And in this video, we're going to go through really like 3 categories of what they mean when they say, oh, our pet peeve is when a student is just not professional. They don't exude attributes, or they don't seem like they'd be a great physical therapist in the clinic or out on clinicals representing us, or, talking with administration, all that stuff, right? That's what they're thinking of when they get this non-professional pet peeve vibe from me. Let me just go through all of them, then we'll circle back around and go into detail about each one of them. So really what they mean is things like non-professionalism is like not being punctual, not being courteous, not being attentive, and not just being a normal like human being that they can see in the clinic. So however, if you walked into a physical therapy clinic, or if you were on the other side of the table interviewing somebody for your physical therapy school, you would automatically pick up on the nonverbal or verbal things that would turn you off and say, this student is not ready to be a doctor of physical therapy. This student is not ready to represent our school out on the clinic. You would easily pick up on that. And that would just be things like, hey, this person is just kind of awkward. They're not really ready for the big leagues. They're kind of just, yeah, nervous is okay, but they're a little too nervous, and if this translates into the clinic, that won't be a positive experience for the patient. So as long as you're like human, normal, natural, relaxed, comfortable, that's kind of a baseline of what they're looking for, of this baseline of or foundation of being professional. So that's what we're going to talk about in a second. Next is really for the future. What are your goals? What are your future plans? Or are you just like, yeah, I just want to be a PT to help people, but I don't really know what I want to do, or I haven't thought about it at all, or yeah, I'm just doing this because my parents said I should do something in healthcare and this seems safe. I don't want to be a doctor, or I don't want to be a physician and spend all those years in school. So I like sports, so this PT thing is okay. They deem that as being non-professional as well. Then lastly, of course, now professionalism comes down to how do you communicate in emails, on the phone, on a Zoom interview, and everything like that. Then dress comes into play as well. Okay, so now let's circle back to the top with just being human. Okay, so when you're not punctual, when you're not courteous, when you're not attentive, when you're not paying attention to your surroundings, they're just like, if we're sending out these students into the clinic, if this student is going to be an alumni of our program, they're going to be a representation of us like forever. Do we want this type of student who's not attentive, non-punctual, just kind of awkward? Not the like normal level of, hey, I'm nervous, this is a big interview. I understand that. I'm talking about like just, you guys know what I'm talking about. I'm not going to go into detail. You guys already see the image. That's just going to be like, this student is not ready. This student is not ready to go on socially to the next level. And if they're doing all these things right now and in our interaction, how will it be when we're not around? Or how will they represent us in the next step? So really these basic foundational human things that we're taught when we're little need to definitely be translated into the next level when you're going into these interviews or campus visits and these email interactions and Zoom calls. That's what they're saying is, this is our pet peeve of students not being professional. They show up late, they're staring off into space, their phone's always out, they're always checking their Apple Watch, they're just not here. They're just not here. So if you can stay here and you can stay focused on them and show that consideration and respect, that will go a long way. So I don't want you to overthink this at all. Just be a normal, regular, respective, considerate human being, and boom, you will automatically have the foundation down. All right, next, now we have to talk about the future, because if you want to stand out, we talk about this so many times, what they deem as not professional is, like I said before, if you have no plans for the future, or if you don't have a strong reason as to why you want to be a physical therapist. They just seem, it just seems like you're, again, not ready. Like, why would we accept you into our program and make you one of our colleagues in this profession if you don't even really know why you want to be here, or that you really want to be here, or you're just trying to fill up this seat or this position to make your parents proud, or to make you feel like you checked off another box for your peer groups, like, oh yeah, I'm going on to the next stage in life, I got into this physical therapy school. Like, just nonchalantly going about life and trying to get into this program, they see that as a pet peeve, and that kind of gives them the ick or grinds their gears. Like, this is like, why would we want this student in here if they're not even ready for the next level, if they're not even thinking about their future, if they don't have specific goals? So as we've talked about before in other pieces of content, what you want to do is get as specific as you can right now. You might not have every detail of your goal, that's fine, I'm not asking for that. But what you need to do right now is make sure that you have some type of trajectory for your career. Like, okay, I want to be a physical therapist because I injured my knee, or I injured my ankle, or my parents went through something. Whether it's a generic story or not, you have to have some solid foundation as to why you want to do this. And because of that why, now where are you going to take that next? Okay, my grandmother had a stroke, and now because of that, I'm very interested in how rehab is for people with, you know, right-sided strokes, or right-sided CBAs, or traumatic brain injuries, or whatever. So I'd love to learn more, whether it's clinicals at your school or after I graduate, as to how I can do that for other people's grandmothers. And if that changes in the future, great. But right now, that is what's really calling me to PT, and that's really what I want to do. It could be as simple as that, or it could be as complicated as I want to be a physical therapist for the Olympic soccer team, and make sure I do that in 7 years, and by year 3 I'm going to be on the Special Olympic soccer team, and by year 2 I'm going to be working for Exos Clinic out in Arizona, so I can get hands-on experience with athletes, and by I don't know, 5 months at a PT school I'm going to do a sports residency. It could be that detailed, I don't care what it is, but as long as they see that you have a why, and you have a goal, and you have a plan for the future, you are good. Then lastly, of course, your communication and your dress, whether it's communication on emails or through the phone, or your dress in an interview, that goes a long way as well. So just keep that in mind. Your grammar and communications, your email style, if you have a signature at the end of your email, if it's spaced out, if it's very short, you know, all the stuff that we've learned before with how to communicate professionally, that's what you want to do. Then dress, lastly, yes, that does play a role, because when they see you before you even talk, they're just going to see how you're presenting yourself. So interviews, campus visits, dress as professionally as possible, and you will be great. So the main point of this video was, with professionalism, it does not always include, hey, put a tie and a suit on, because you can have a tie, a suit, a blouse, earrings, you can look as great as possible, but if they hear you speak and you are not ready, and they see that, yeah, the student doesn't have it, that's it. What we talked about in this video is it doesn't matter what you wear. It really doesn't. It really comes down to all the things we talked about in this video. So hope that gave you some perspective on this biggest pet peeve. I don't know what we're going to call this video yet, but the biggest pet peeve that I've heard from schools, from students, going through student cycle over cycle over cycle. This is what they see over and over again that they wish students would know. So hope you enjoyed that video. If you are new to Pre-PT Grind, again, I'm Casey Coleman, physical therapist and the co-founder of Pre-PT Grind. We help thousands of students get into PT and PTA school without wasting time, money, stress, and everything in between. So if you like that, hit subscribe, like, comment, and we'll see you on the next video.